welcome to Sir-Kenneth's Talk Show! Good day and welcome back to this new edition of Sir-Kenneth's Talk Show. For those of you who are not yet aware, I recently went through surgery, and today I'll be taking you through that process that I went through of the surgery. But before we begin, please you know what to do. Hit the like button and subscribe to my channel for more content from Sir-Kenneth. So without further ado, let's get into it. Okay, let's get into it. So the surgery I went through, sorry y'all, I had to write this down because it's a really difficult kind of word for me to pronounce. The surgery I went through was called a breast nodulectomy. Breast nodulectomy. Yeah, I really needed to write that down. Okay, so it's basically a lump that was growing in my chest on my left breast. So it was really like really big. Like, yeah, I know, so disgusting. Though it technically it's not a deadly kind of something. I could have as well lived with it, but I really didn't want to because I mean it didn't make my chest look good. I couldn't go to the pool, I couldn't go to the beach. Not that I've ever been to any of those places, but you know, that's besides the point. I just really didn't feel comfortable with it, you know, and I really had to do something about it. And it had been on my chest for a while now, like 2 years plus. And you know, when I first noticed it, I freaked out. I was like, my first thought was that hope it's not a tumor, hope it's not a cancer, hope it's nothing like deadly. Like, yeah. My sister's a doctor, fortunately. She's the only person I told about this when I first noticed it. Like, she's the only person I told. I didn't tell my mama, I didn't tell my daddy, my brothers, I didn't tell anybody. I only told my sister because she is a doctor. And I was kind of freaking out, and she was like, she told me to explain, like, give her the details on how does it feel, like, does it feel strong inside it, it's a liquid coming out from it, like, does it pain? You know, funny enough, it didn't pain, no liquid was coming out from it, it was just standing there, like, really disgusting. It didn't really look like, it was not a beautiful kind of thing to see. And you know, she was like, okay, it's nothing serious. She prescribed a few tablets for me to take, a few drugs for me to take, which I never ever got. I don't know why. I'm not a medicine kind of person. Yeah, so a year passed by, 2 years passed by, 2.5 years passed by. I was like, okay, this is really not good. Okay, this is really not good. I'm growing old, and you know, I just don't want to reach this stage where, you know, anyway, I'm not going to say what I want to say. But anyway, it was really not nice to see anymore. So I called my sister this time and I was like, hey, you know what, I'm coming home. I need this thing off my chest. And she's a doctor, like I said already, and each time I consulted to her, she consulted her boss, who is the doctor who eventually operated me, the good doctor. I call him the good doctor, Dr. Leo. Yeah, so he did operate me with his team of doctors. Yeah, you know, the day I went to the hospital, it was the day my parents knew about this, even my brothers. And my brothers too. It was on that very day that they knew about this whole situation, you know, and they were freaked out when they saw it. My daddy was like, "Wow, that looks like a woman's breast," and my mama was like, "Ma, she's always so overly dramatic." Okay, you know. And then when I went to the hospital that day, they didn't know I was going to be operated. But when I came back, thank God it was a minor surgery. I didn't have to spend any days in the hospital. I mean, they operated me, and I went back home that very day. So when I went back home that day, mom was like, how did it go? And I just showed her my chest, and she was shook, like, what happened to you? You know what I'm saying? Yeah, so it really took my parents by surprise, my mother especially, you know, and she's always so very protective and very sensitive. And, you know, she was really, you know, shook about this whole situation. But we thank God everything did go well. So, like, the craziest thing happened while I was in the theater, okay? First of all, the anesthesiologist came in. I hope that's the term. The doctor who is in charge of, you know, injecting the patient with local anesthesia. He came in and he was really so, I don't know if brutal is the right term, but he injected my chest from every angle. Wow, I felt a lot of pain. Like, fun fact, that was the most pain I felt throughout the entire surgery. Like, because when they're operating you, the anesthesia has been injected, so you don't really feel pain. But once he was injecting it, I mean, from every angle, from on top, from below, I was like, wow, this really hurt. And my sister wasn't. She's a doctor, but she wasn't among the doctors who were operating me. She was in the theater though, but she was just there for moral support, and I had to hold her hand throughout because there was no way I was gonna make it in there by myself. But once she when she came in, I was like relieved that at least I have somebody that I can hold on to. And fun fact, I know this sounds really crazy, but for a minute I thought I was gonna meet Jesus that day, which which was definitely not going to happen. I was just being overly dramatic. I just do that sometimes, like be dramatic over nothing. But it went so well. And once when the doctors were operating me, they were not always talking about. They were having small talk during the operation. Like what the things we were talking about were not necessarily related to the operation. They were having like their fun kind of topics during the operation. I was like, wow, I hope in my mind I was like, I hope you all know what you're doing, okay? Yeah, but I trusted them because my sister wouldn't let me in there if she didn't trust everybody in that hospital. And just for that, I took the chance and I went in there, and they did your thing. They really did your thing. Oof, they did your thing. And I was really uncomfortable because I had to take off my shirt, and it was mostly female doctors and nurses who were in the theater. And that's something I had to do throughout, because after the operation I had to be coming like on a daily basis, so after a few days to change the plaster and the bandage, and each time I got in there I had to take off my shirt, and I was really really a little bit uncomfortable with that because taking off my shirt is not something I do very often. Because like I said, I've never been to the beach, I've never been to the pool, so I feel like my body is really, really my privacy. So the fact that I had to take off my shirt each time was really not very comfortable for me. However, I had to do it. It was for my own good. Yeah. So, and each time the wound was being changed, the plaster was being changed on the wound, my sister had to be there and to hold my hand because it was painful sometimes. It was painful, and the doctors took really good care of me. Like I don't know if that's how they treat all their patients, or do they treating me that way because my sister works there. But I hope that's how they treat all their patients because they really like took really good care of me. Gave me, I mean, the director of the hospital, who is a doctor who operated me, he was one changing my plaster like almost all the time. Maybe the last few times I went there, someone else was doing it, but most of the time he was the one like taking care of me. And I really really appreciated that. I just felt like, I don't know, I was really I was really grateful for all of that, for all of that care and treatment they gave me. But there was this one nurse, this auntie, God, I will never forget that auntie. I mean, she changed the dressing ones, the plaster ones, because something happened like after the operation. Once they saw the wound, blood was accumulating, blood and pus. Is it pus or I don't know? A funny fluid was accumulating in my chest, so they had to drain it for the wound to heal normally. So this what they did to drain it was like they inserted like some sort of drain in the wound. So they had to. Oh God, I don't know how to explain it. They had to insert a drain inside the wound, and it was really really painful. When the doctor did it, he tried as much as possible for me not to feel too much pain. But it was this one nurse, this auntie. She did her job really well, but it was too well for my liking because I felt a lot of pain that day. And fun fact is, the wound really drained after that dressing done by that nurse. So in spite of all the I don't know if I should use the word harshness, but I feel like she was doing a really great job, and the wound really really drained after that. And unfortunately, since I didn't have the operation here in Yaoundé, I was out of town. I was in my hometown, and I had to travel back. Since I was on leave, I had to travel back because my leave was over, and the wound had not yet completely healed. I went to this other clinic. His clinic, the doctor who owns the clinic, actually is a doctor recommended by the company I work for. So I went there, and he You know this feeling, like I feel like in the professional world, everybody has done this one or twice. Like, let's say I'm a publisher, right? You know, I'm an editor. If a book comes from another publisher or another editor, like if a book comes from another publishing company, that, you know, this company worked on this book and they really didn't see the finish line with it, and then the author had decided to change his publisher, and it comes to me, I'll have all the critiques in the world on that book. Like, why didn't this publisher propose this instead? Why didn't he suggest this instead? You know what I'm saying? That's how it is. That's It just happens naturally in the professional world. That's how it is. We always tend to try to criticize our opponents or our peers who are not necessarily our direct colleagues. So when I went to this new doctor, he was always like, the first question they asked me was like, where was I operated? Was I operated in theater, like in the hospital, or was I just opened or was I just operated by a set of nobodies? I looked at that nigga in the eyes, like, do I look like somebody who'll be operated by a set of nobodies? And then the next question he asked me was like, the doctors who operated you, were they surgeons or they're just regular doctors? I was like, nigga, if you don't shut your ass up and do your job. You know, he was just trying to look for the least thing to criticize, like on what the other team of doctors did. And he even asked me if I was on antibiotics. He said, yeah. I said yes. He asked me what antibiotics I was taking. Fortunately, I had my hospital book the first time I went there. I showed him, and he was like, he needs to say this antibiotics and make sure that they're original. I'm like, nigga. He was like, where did I buy them from? Did I buy them from a pharmacy or I bought them on the streets? I'm like, do I look like someone who'll be buying drugs on the streets? I almost punched that doctor that first day. But anyway, all is well that ends well. He dressed the wound instantly. And I noticed something when I went to this clinic. His way of treating me was so not the same way I was being treated. Like, in the hospital when my sister was, Santa District Hospital. That's where my sister works. While I was in Santa District Hospital, whenever I went for the dressing of the wound, the doctors made sure they took off the plaster themselves. They made sure they cleansed the wound and then did your thing. But this new doctor, each time I went there, he would tell me take off the plaster myself, like, which I don't have an issue with, but it's just the way he said it the first time. Like, it's too disgusting for him to touch. I'm like, but anyway, like I said, all is well that ends well. He dressed it till the last day. Today was the last day. We took off the last plaster today, so my chest is beginning to regain back the shape. Though I'm feeling some light pain around the wound area, but the doctor says with time the pain will subside. So yeah, so basically I can now take a full shower. Another thing is I wasn't able to have a normal shower. The day of the operation, what the doctor said to me is, and I'll use the exact words he used. He said, what was it? He said, I'm now licensed to cut Seba. Like, officially, I have the license to cut Seba, something like that. Which means, for those of you who don't know what cut Seba is, it means bathe without bathing your whole body. Like, you wash your hands, your feet, your face, your head, without wetting the wound area. So that's what I did for the past 3 weeks. I just took my first shower in 3 weeks today, my first complete shower, and it was the most amazing feeling ever. Yeah. Another thing is, while I was away, when I went through the surgery, and after that, a few people reached out, colleagues reached out, friends reached out, and the funny thing is, people whom I least expected to reach out did reach out. Like, my superiors, my direct bosses, some of them actually contacted me. I'm like, they were kind of concerned, and I really, really did appreciate the concern, because my bosses are not people I laugh with on a regular basis. They're not people I'm very friendly with, because when your boss is your boss and you are you don't really always have a very friendly relationship with your boss, because you need to keep that respect. You need to maintain a certain level of respect towards your boss, and you can't just clown with your boss on a regular basis. But the fact that some of my bosses actually reached out and to find out how I was faring, how I was doing, it was really, really unexpected, and I really, really did appreciate the gesture. And funny thing is, people whom I'm really more familiar with, whom you know, I'm more versed with, like we talk a lot more and we're kind of closer. Some of them didn't reach out and were fully aware of the situation. And I'm not really mad about the fact that they didn't reach out. But what really pissed me off is once they saw me, they were acting like trying to act all concerned. If you don't want to, if you were that concerned, you should have texted me the minute you heard about it. But don't see me 3 weeks later and you're like, I heard something happened to you. Like, that's just a different level of, hypocrisy, if I can say it like that. But at the same time, they owe me nothing and I owe them nothing. So it's just in times like this, who really writes for you. Like, from January to December, who got your back always. And yeah, that's it. That's basically all I can say. But anyway, it was a successful surgery. I'll always, like, forever be grateful to Dr. Leo and his team of doctors for taking care of me. Now I can go to the pool and the beach and take off my shirt. Yeah. So that was it. Stay tuned. Thank you for staying tuned to Sir-Kenneth's Talk Show. I hope to see you next time for another episode.